Future Career Decisions Part 1. Nursing is going to open the door to a varied career for you. There's typical nursing careers and there's atypical careers. By this time you know that nursing really changes you and it's a maturing experience. You won't be able to share a lot of what you see with anyone outside of the facility, but again, nursing matures you. We've seen a lot of growth in our students over these past several months. Now, NCSBN has developed a transition to practice model. It's not currently in effect, but it's something that they're still investigating. Basically, their goal is to improve retention and patient outcome rates. They have 5 modules set up with communication, teamwork, patient-centered care, evidence-based practice, quality improvement, and informatics. There is a preceptor that will assist the new graduate. And after about a year of practice, what they're recommending is that the new graduate will then provide the State Board of Nursing with a transition to practice verification form that's been signed by the graduate, the preceptor, and the supervisor. I inadvertently skipped a slide, but you can read it. The personal attributes that are very helpful. Just make sure that you know that nurses really need to be emotionally stable. They experience a wide variety of things. They help people in their journey to die. They help people in their illness. They help people, or basically they see people at their worst. And sometimes it can be very difficult when people don't feel good. They are not very nice. And we can't take it personally. We've got to be able to put everything in its little box and deal with it appropriately. So nurses need to be able to find ways to relieve stress, healthy ways to relieve stress at the end of the shift that's not going to contribute to personal health problems. Now, the extended care facilities, traditionally, healthcare was based on diagnosis and treatment of illnesses and conditions. But now there's many more healthcare opportunities available. One of which, where LPNs can find a job, is in the extended care facilities, and we've talked about this many times. We know that long-term care is probably the fastest growing area for LPNs to work. These facilities can have a variety of residents. They may be short-term residents that are there just to regain their strength from a surgery or a trauma, or they might be someone who just developmentally, whether it's a chronic mental illness or a developmental issue, that they're not able to take care of themselves and their family's not able to take care of them. So just a wide variety of issues. Take a look at the skills and personal characteristics that are really recommended to care for the extended care facility residents. Now, the OBRA, or the Omnibus Budget Reconciliation Act of 1987, mandated that all skilled nursing facilities and intermediate care facilities provide 24-hour LPN care 7 days a week with at least one RN during 8 hours of that day. 7 days a week. When you have a facility that has fragile residents or Alzheimer's patients or other dementias, a lot more staff is needed in those facilities. So this is definitely an area where LPNs can find work. Another area to look at is home health nursing. Home health is really increasing in its importance these days. It successfully reduced the overall cost of healthcare in the United States. Some of the treatments that patients require cannot be done by a home health aide. So therefore they're starting to pull LPNs into some of these positions. LPNs will be under RN supervision, and the one thing that LPNs really need to watch for is that they're not used as a home health aide. If they are used as a home health aide, they're still held to LPN standards, even if they're not doing the work. That's their highest licensure, and that's what standards they will be held to. So really know what you're getting yourself into before you sign on for a job. Mental health nursing. Remember that mental health nursing is just not quote crazy people or mentally disturbed people. A lot of time mental health nursing has to do with people who are dealing with high anxiety levels or a lot of depression. Excuse me, and they don't really fit in some of your psychoses or bipolar disease, etc. It's really important for you to have a knowledge of the mental health concepts and therapeutic guidelines. These LPNs in this type of nursing care are involved in performing treatments, administering medications, and tending to activities of daily living. They also play a significant role in developing therapeutic relationships with patients and following the interventions established by the RN. Mental health facilities practice a team concept in which everyone is expected to know those therapeutic guidelines in a patient care plan and to be able to carry out that plan. You can see the skills and personal characteristics that are preferred in a mental health nurse, but one of the most important ones is going to be the therapeutic communication skills. Another area of possible employment is the military service. The opportunities offered by the military, they can cross-train you for different areas. In addition to, they can help finance your education if you're wanting to extend your degree and you're finding that you are racking up too many student loans, etc. Hospital nursing is another potential area for an LPN to work. Currently, 1 in 8 hospital nursing positions is unfulfilled. is unfilled. But LPNs are often underutilized in these particular areas, mainly because RNs just do not know what LPNs are qualified to do on a legal standpoint. So it's really important for you to know your scope of practice, make sure that you review the job description and know what the facility will allow you to do, in addition to knowing your Nurse Practice Act and knowing what your state will allow you to do. And be assertive. You know, you've been training to be able to perform LPN duties. Don't let someone take that away from you. Sometimes in the hospital situation, additional training and experience might be necessary. And again, you can read these skills and personal characteristics that are recommended for hospital nurses. Other potential areas would be outpatient clinics, doctor's offices, and chiropractic offices. These can be a variety of skills. A lot of cross-training might be required because you are assisting the physician with patient care. You may be called on to draw lab or even to run some basic labs, to shoot an x-ray or perform clerical duties, definitely to answer the phone and talk to patients. So you need to have really good communication skills and be a people person, be able to be self-directed. But you also have to not mind a lot of routine, because definitely physicians' offices are very routine in the work that they provide. Operating room nursing. There's been a trend for a lot of technicians to be hired as OR nurses, but they are OR techs. They're not OR nurses. They don't have that nurse's training. That's something that LPNs might consider, is going and receiving some OR tech training and being able to assist the surgeon by handing instruments, etc. The VA is another area where LPNs can potentially find careers. You don't have to be a veteran to apply for employment in these facilities, and the salary rates are based on the grade and performance. Sometimes there's overtime and sometimes there's shift differential. Working with the nation's veterans can be extremely rewarding, especially knowing that you're providing care to someone who has potentially risked his or her life, so that we can experience the freedoms that we have here in the United States. So possibly an area you might want to consider. The main qualification for working in a VA center is that you are a U.S. citizen, that you are graduating or have graduated from an accredited nursing school, and of course you should be proficient in the English language. Hospice is another area where LPNs are often employed. This is the area, of course, where the terminally ill patients are cared for. Sometimes they're cared for in specific institutions. They do have hospice hospitals or hospice houses. That might be in the patient's home, it might be in the hospital, it might be in a long-term care facility. But basically the main role is going to be able to keep the patient comfortable by improving their quality of life. They're not concerned about the quantity of life. There's many other places where LPNs might find jobs. You can read some of them here. But to accomplish the goals set in each one of those jobs, it's really important for the nurse to be comfortable with his or her nursing skills and in the provision of care. And sometimes you have to be innovative in that provision of care. Excuse me. Additional possibilities for employment might be residential treatment centers, medical management companies, the prison systems or local jails, corporations, daycare centers for adults or children, weight loss clinics, social service agencies, ambulance or emergency service staff, dentist office, blood bank, substance abuse clinics, schools, adult daycare, I just said that one, welfare, religious organizations. Parish nursing is actually unless you live in Louisiana where the counties are called parishes, parish nursing is a church nurse that has been hired to make home visits to the congregation or to provide just simple basic care to the members of the congregation. There's specialized mobile units such as the Bloodmobile, fitness centers, the Peace Corps, just a variety of areas that LPNs can potentially find jobs in today's world.